Okay, thank you for coming in today, Tiff. So we're here to discuss your back pain. Rosalie, you take the lead.
Okay, so I'm going to be asking a few questions a little bit more about that pain. So, has anything happened to you? Have you gotten into an accident? How did it come about?
So nothing too specific that I can remember, but 2 years ago I was back squatting, and the next morning I woke up with really bad back pain, thoracic back pain.
Okay, and where is that pain exactly?
So right here. So my left shoulder blade just on the inside here.
Okay.
Alright, and does that pain come about like when you're doing your regular activities during the day? Do you find this a certain moment it hurts more, like when you wake up, or if you're in certain positions?
So it hurts more at nighttime, and anything that like compresses my body. So if I have my book bag on, that hurts. Anything overhead, that hurts too.
Okay. And in terms of like if you're standing for a long period of time, do you notice it hurts at all? Like do you feel more relief when you kind of like hunch over?
Yes. So if I do this feels a lot better.
Okay.
Yeah.
Okay. In terms of pain at night, does it wake you up at night?
No.
No, okay. And the pain's no longer there in the morning?
I feel like it depends how I sleep. So like some mornings I might wake up and it's there, and then other mornings I might be fine.
Okay, and did you notice how you sleep?
So if I'm sleeping on my left shoulder, it hurts more in the morning. So I try and sleep flat on my back, but that's really difficult to do every night. But I notice when I wake up on my left side, it hurts more.
Okay, and how long does that pain take to go away?
It depends. It might not go away. Like if I have a heavy book bag and then I come to school for the day, walk up the hill, like it's just there all day long. So there's certain things that like either ramp it up or ramp it down, but it's always kind of there.
Okay. And in terms of other types of pain, so do you have any pain down your legs, or do you have any fever, night sweats? No. Okay. Have you noticed any unexpected weight loss?
No.
And the pain is localized. You don't feel like it's diffuse.
I feel like I could pinpoint where I feel like it originates from, but depending on how irritated it is, like if I do a CrossFit workout and there's a lot of like overhead things, then it kind of like spreads lower to my shoulder blade. Sometimes like a little bit of nerve involvement into my arm.
Okay.
So it's not just local.
Let's talk a bit more about that nerve involvement.
Okay.
Do you have any change in sensation? Like, do you feel like it's numb, tingling?
Like a little numb and a little tingling.
Okay.
But like no shock feeling or anything.
Okay. And from that, do you have any headaches or neck pain from that?
Sometimes I'll have a little bit of neck pain.
Okay. And does that come about with the same time, like at the same time as you have that thoracic pain?
Usually.
Or?
Yes.
Okay. Interesting.
Like when you work.
So, do you have any pain at rest? Like if you don't do anything?
Like right now I'd say I have nothing, but I'm sure if I put on my book bag and go walk outside and come back, I'll feel it.
So usually you kind of need something to kind of irritate it a bit.
Or like if I slept poorly, then it's like irritated.
Yeah, perfect. And you said that you do a lot of workouts. Do you find it prevents you from doing certain aspects? So like CrossFit workouts, you said overhead. Can you still do those things?
I could still do them, but I choose not to because I've noticed that when I do them, it irritates it and then it's like bothersome for the next 2-3 days, so it's just not worth it to me. So.
And then is that something that you would like to get back to?
Yeah.
Okay. What's the least your pain is? 0 to 10, 10 being we should call the ambulance right now.
0.5.
Okay. And then what's the worst it's ever been?
10 if I call an ambulance. Maybe like 6.5.
Okay. And then right now, where is it at?
0.5.
Okay. Does it ever go back to 0?
Not well.
Good for you. Are there any other activities that you think, this pain is really interfering with this, I need to stop this?
No, I notice sometimes when I'm running, like, I'll kind of feel the nerve involvement to my arm.
Okay. Yeah. Do you have any, besides that one time you were squatting, any other previous history, any other injuries,
No.
Any other conditions? Okay. And ever had any change in sensation in the general area? Any problem urinating?
No.
Any problem defecating? Okay. Any recent surgeries? Do you have pain when you breathe, by any chance? Like if you take a really deep breath, do you feel it?
I feel like when this started 2 years ago, I noticed that if I were to breathe deeply, it would annoy me. But it's gone.
That
now.
same pain?
Yeah.
Okay. And then, do you have pain when you cough or sneeze, or you try to do a tensing movement, like a Valsalva? Okay.
Is there anything else you'd want us to know?
I don't think so. I think that covers it all.
Okay, so
Oh wait, fun fact. I've been told I have a bit of a scoliosis in my upper spine, a little bit to the right. I don't know if that'll
Like concave or convex to the right?
concave to the right.
Okay. So you're more convex to the left. The side of your pain.
we'll see. Is there anything else that anyone else on the team would like to add? Any other questions?
Maybe any other injuries, if she's ever had anything else in that involves someone else that.
Yes.
Any imaging ever done?
How did they?
No, because they deemed it wasn't necessary.
So how am I
My
get a
MD.
diagnosis for scoliosis?
My doctor.
Like just from observation?
Just from observation.
Okay.
But no imaging.
And have you done physio for it before?
I did, but it didn't really help, to be honest.
Okay.
So
We'll try to change that for you today.
please do.
And when we talk about the treatment, we'll go over what you did prior and what you found helpful, what you didn't find helpful, and where we'll go from there.
And maybe one last question. We did talk about what aggravates it, but we didn't really talk about what helps it. Like obviously rest you were talking about, but did you do anything for it? Like ice?
I used to put heat on it. It helped. Bending forward.
Yeah.
That
Like anti-inflammatories? Have you ever taken?
I took those, they helped.
Yeah, they help.
But
Or
I
you
didn't want to take them forever. So
Okay, so you kind of stopped. Okay, so now do you still take those like for really extreme cases or no?
No,
Just try.
because I avoid getting to that point
Okay.
by eliminating CrossFit.
Do you find that if you crack your back, do you crack your back to help at all?
Oh yeah, I
or-
crack it all day, like multiple
Okay.
times.
And how specifically do you crack it?
I can show you.
Is it this sort of thing?
Like
You're
I could,
shifting
like
movement?
on a sharp edge, just like bending back this way. I don't know if you heard that, but just cracked.
Okay. Great. So, anything else to add to this objective? Right. So, given what we've heard, what do we think is going on? What are our current hypotheses?
It kind of sounds like something in extension, like we don't know if it's a hyper or hypo.
But it feels
But
better in flexion.
Exactly, it feels better in
so-
flexion. She doesn't like overhead things, and overhead movements require an extension of the thoracic spine, so it could be something like
And
that.
it did come from a box squat when she was
Yeah.
an extension.
When you're in
Yeah.
So-
So we're thinking possible prior trauma with a bit of insidious mixed in.
Mhm. Yeah,
More micro.
Yeah. Okay. So,
Move on
objective.
to observation.
Alright, so I'm just at the edge of the bed. So I'm just gonna do some observation. I'll have you remove your tank top if that's okay.
Sure.
Perfect, thank you. Alright, so I'm just gonna look first at the alignment. So seeing if the ear kind of aligns with the shoulder. So slight forward head posture. I'll start by looking in front. So we kind of see that her left shoulder is a little elevated compared to your right. Are you left or right-handed? Left. Alright, and then coming in from the back, so we definitely see an increase in muscle tone in over here. And I'll just have you take a deep breath in. Good, and a deep breath out. Okay, so the ribs are moving nicely with that, and it's equal on both sides.
What side has more muscle tone?
Yeah, just
Right.
you can't say over here. We can't really see it.
Can you say which side I have muscle
Yeah.
tone?
Her left.
Okay.
There's
There
an
you go.
increase in left muscle tone, but in her there's like just big traps as well, like an increase in just traps in general. But if you see on her left side, if someone else wants to come and see, they can. So you can see that there's an increase in her left muscle tone onto the side.
Well,
That's
Yeah.
artificial.
Okay, so that's about it for observation. So again, just posture, slight forward head posture. So just a little bit here, but you can see there's an increase in tone in both.
she's just very, very strong. All for strong female figures.
Alright, so we'll move into the range of motion. So this is just to see how well you're moving and to see if there are any types of discrepancies that can maybe help us figure out what's maybe wrong with you. So first I'm going to ask you to cross your arms, and I'm going to ask you to turn towards the right as far as you can. Okay, that's good. Anything with that?
No.
Okay, so towards the left. So she looks like she has a bit less range towards the left, so you can come back. I'm going to do that again with overpressure.
It feels like I had more to the left.
But looking at
Yeah.
you. Alright, so towards the right. And then with the overpressure, so I'm looking at quality and quantity of the movement. Is there anything in that? No. So back to the left. So I can definitely feel like there's more of an early elastic infill on that one. So for the next one, I just want you to dip your shoulder towards your hip. So yeah, I'm just gonna start by looking at the movement. So how's that? Any pain? Do the other side. How's that? That's good. Okay, so I'm gonna add a bit of overpressure, so same thing.
Do you need to bring the plinth down?
Yeah, actually, that might be a good idea. Okay. So we're gonna do that again. Okay, I definitely feel less range as I'm moving up. I do the same thing on this side. Okay, so I get less range on the left side. So left rotation, left side flexion. Perfect. The next one, I'm gonna ask you to just slouch, but I don't want you slouching from the bottom. I really want you to, yeah, exactly, tuck your shoulders in. So how's that?
Doesn't really feel like I went anywhere, but
So a bit of overpressure and come back up. How's that? Was there anything with that? No. Okay, now we're gonna do extension. So just lean forward for me a bit, and then bring your arms towards the ceiling as far as you can. Okay. How's that?
good. Doesn't look like I'm moving.
Overpressure. How's
It
that?
doesn't hurt, it just feels
Stiff.
Yeah.
It felt really stiff in terms of the quality of the movement. And I'm gonna do a quick little rhythm just to rule out any type of. It's a resisted movement. Okay. I was gonna explain that, but thank you for asking. So I'm gonna keep your arms like this. So when I try to move you in that kind of direction, I want you to resist me. Okay, so I'm just gonna hold it. 2, 3, 4, 5. Anything?
No.
Okay. 4, 5, very good. And then I'm gonna bring you downward. So I want you to 2, 3, 4, 5. 1, 2, 5. Very good. Very strong. Anything with those? No. Okay, so we're just gonna do flexion extension. So for this one, I'm gonna be pulling you up. I want you to resist me. Perfect. And then for this one, I'm gonna be bringing you down. Very good. How's that? No pain? So we've ruled out any type of fracture. Okay, so now I'm gonna do a combined movement to try to see, kind of confirm the findings that I just saw with your regular movement. So for this one, and keep your arms here. Just let me know if ever you get tired, okay?
Okay. Hope I don't.
Okay, so I'm gonna start with the side flexion. So we're gonna dip your shoulder like we did, and then add a bit of rotation. How's that? Good. Okay, so other side. Okay, so I definitely get a lot more range like this.
That way.
Yeah, especially when I bring the rotation component in. So now we're gonna do this, and then how's that? How's that?
It doesn't hurt, like I could just feel my spine stiff.
Stiff. Which, is there a side in particular, or you just feel like it's the whole thing?
Like upper right side.
Upper right side. Okay.
And I didn't feel that on the other one that you did.
Okay, perfect. So because we're thinking that it's more an extension, we're just gonna do the combined movement in extension. So just, yeah, so lean forward a bit. And then we're gonna bring you like this, and then anything like that? Yeah. This. So I definitely get a lot more movement again on when I'm sunsetting towards the right. Versus the left. Yeah.
So what's your findings from that?
My assumption or my findings like decreased left rotation, decreased left side flexion, and then decreased combined movements, especially extension side flexion.
But no pain.
No pain. The only time I had pain was when I was doing the rotation, the ipsilateral on the right. Okay. Before we proceed to, did anyone else want to do this? Or we're good?
I think those are good.
Okay. Before we proceed to neuro.
Traction
Traction
and compression.
Oh, so can you point yourself that way, please?
My whole body?
Yes. Alright, so I'm gonna do a couple things and you're gonna let me know if this changes your pain at all. Alright, so can you cross your arms across your chest, please? Alright. Is this comfortable for you? Alright, let me know what changes your pain.
It feels nice.
No contraction. Alright. And then, does this change your pain? Alright, awesome.
Oops.
Okay.
Alright.
So, you guys just
Don't mean to sing this way.
Yes, please, thank you. So we're just going to take a look at how your neck is moving. So as we go through any of these motions, if there's any pain, stiffness, just let me know. So first thing we're going to do is left ear, left shoulder. Good. How's that feel?
Tight.
Tight. Same thing on the other side. Good. And come up here. And we're going to do the same thing again one more time. Over there.
It just feels like really
Tight.
in my muscles.
Yeah. Little elastic. Same thing on the other side. And just facing it opposite. Good. How's that feel?
Less tight than this side.
Yeah, so she has a little bit more range going to right side flexion. We're going to do now rotation. Excellent. How does that feel? Good. Good. Same thing on the other side. Really stiff. Really stiff? Alright, so you're going to look towards me again. Excellent. And how are we here? Good. Good. Okay. Same thing on this side, looking towards me. Excellent. And how's that? Okay. Alright. Flexion and extension, I'll get you to look down towards your chest. How's that feel?
Okay.
Good. And good here.
It feels good.
Feels good.
That's like one of the
Relieving positions. And then chin to ceiling, so looking up. Excellent. And anything there?
It doesn't feel good. Like here.
In the back?
Yeah.
Lower down?
Yeah.
Okay. Alright. Upper lower down?
Yeah. I'll come this way.
Okay, so earlier when Rosalie and Louise were asking questions, you were saying you have a little bit of tingling, sometimes it goes down your fingers. So we're just going to do a little bit of a neuro exam to see how your sensation is and strength is, to rule out any problems there. Does it sound good? Okay, so I'm going to get you to close your eyes. And I'm going to touch your skin, and I want you to tell me if you feel it. Yeah? Does it feel the same on both sides? Yeah? Put your hands out. Open them up. And touch here. Does it feel the same? Yeah? Here? Same on both sides? And down here? Same on both sides? And the other side is here. And here? Same on both sides? Okay. Open your eyes. So now we're just going to test the strengths of your... Okay, we'll do it like that, and we'll do this way. Feel the same on both sides? Good. Okay. Open your eyes, and we're gonna test the strength of your muscles now. Okay. You're gonna lift your shoulders up towards the and hold it there for 5 seconds. 1, 2, 3, 4, 5. We're gonna do that 5 times. Relax. Up. 1, 2, 3, 4, 5. Again. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. 5, and one last time. 1, 2, 3, 4, 5. Good. Now you're gonna bring your arms out to the side like this. Bring your elbows up. Good. Hold them for 5. 1, 2, 3, 4, 5. Relax. Again. 1, 2, 3, 4, 5. Good. Again. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. And last one. 1, 2, 3, 4, 5. Good. Elbows out like that. Good. And try to bend your elbows. 1, 2, 3, 4, 5. Relax again. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. Last one. 1, 2, 3, 4, 5. Good. Keep your hands like that. Now push down. Good. 1, 2, 3, 4, 5. We're gonna do one at a time here. 1, 2, 3, 4, 5. And again. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. We're gonna do this side. Push it down. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. Good. And last one. 1, 2, 3, 4, 5. Now with one thumb at a time, you're gonna bring it up and don't let me push it down. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Almost there. 1, 2, 3, 4, 5. I think that was 5. There goes that. And again, push. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. And last one. 1, 2, 3, 4, 5. Now you're gonna open your fingers nice and wide. I'm gonna put my fingers in here. And you're just gonna squeeze them. 1, 2, 3, 4, 5. We're almost there. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And last one. 1, 2, 3, 4, 5. Perfect. Now we're just gonna test your reflexes.
Sure.
Okay.
Side note, in doing this, like, it feels a little annoyed here,
Okay.
like muscle wise.
Okay. But in terms of like the myotomes, they weren't fatigued or anything like that. So she kept the strength throughout the entire time. The 5 times 5. So that would be a negative on that side. So we're just gonna test your reflexes. We're gonna do it both sides. I'm gonna come here.
They're hard to find.
Okay, so we're gonna go for the right here. You ready? Just relax and squeeze your teeth together, okay? I'm not very good at this one, but yeah. Okay, and we're gonna do your bicep. So relax, squeeze those teeth together. Good, squeeze, squeeze, squeeze. Good. We're gonna go on this side here, relax your arm. Squeeze those teeth together. Good. Normal reflexes there. We're gonna do the same thing. And then you can't really see it here, but we're gonna go here, relax your arm, squeeze those teeth. Come on this side. Good. And one more. What do I do here? Okay. Squeeze those teeth. Good. So she has normal reflexes on both sides. And we're gonna do one last thing. We're just gonna now look at the flexibility of the sheath that goes around the nerves, okay, to see if any of that, the tightness there, could be causing your pain. Yeah, okay. So you're gonna take both hands and clasp them behind your back. Perfect. You're gonna
Holding them like this.
just down on the bed. You're gonna slouch forward, kind of really bad posture. Fold it. Yeah, there you go. Bring that neck down. Good. Now I want you to, we're gonna start with the right leg. You're gonna slowly extend that right leg, pointing the toe up. Are you okay? Feeling any pain? No? Nothing? No? Okay, good. And come back up. So no positive there. We're gonna do the same thing on the other side, okay? So you're gonna bring that chin to your chest, good. Slump forward, good. And now do the same thing with the left leg. Good. Anything there?
No.
No? Good. You can come back up.
Like I just feel tightness in my hamstring.
Good. So now Rosalie's gonna do another neuropharyngeal test for you.
Yes. So as Shireen was saying, your nerves are kind of covered by this sheath. So it's kind of like a train inside of a tunnel. So sometimes when there are certain adhesions or when you get inflammation, that can kind of diminish that tunnel, and it can kind of make it hard for that nerve to pass through. So what we're testing here is to see whether yes,
We're first gonna move the bed
I'm
though.
gonna give you
Yeah.
a little ride here. Okay.
I think we just need to go this way. Bring your head this way. Good. Yeah, that's good. Yeah, perfect.
Alright, so I'm gonna start with your right side. And just make sure you're not crossing your legs as we're doing this. So for this one, I just want you to stay as relaxed as possible. You might feel kind of weird sensation, so that might be either a stretching or kind of a painful or a reproduction of your symptoms. Just let me know if that turns out to happen, ends up happening. Okay. So, alright. So how are you with this? Rotation. How are you with this? Still good? How are you here? And just let me know if ever you feel any type of
I feel it in my elbow crease.
in your elbow crease. And if I remove this, does that change? Okay, perfect. Alright. So I got her to the end of range for this one before I got a type of symptom. So I'm just going to compare it to the other side. Are you okay here? You okay here? How are you here? And how are you here? Just again, same idea. Perfect. So the only discrepancy is that she felt it at end of range, and that was on the right side. So I'm kind of ruling out neural on the left side as she was kind of going towards there during subjective.
Okay, one last little test. You can sit on up for me.
Facing this way.
Yes, please. So I'm just gonna quickly test your upper motor neuron reflexes, make sure everything is communicating as it should with your brain. All right. So I just want you to stay relaxed, hang out. All right. Okay. Oops, sorry.
Move over to the side.
All right. Hoffman's is negative.
So I'm gonna take my socks off.
I'm gonna take them off for you. Don't worry.
Wow, good service.
You want her to maybe sit up so she can.
That's good.
Is that okay for you?
Yeah.
Okay. So we'll start with your right side, and this might feel a little unpleasant. Just bear with me, okay? So the toes curled, and that's a negative response.
Oh
Ready?
god.
Just move to the side a bit. Louise, just move to the side a bit because we can't see it.
Okay. One more time. You're doing great.
Wait, raise your hand. Arm. Yeah, perfect.
Really tickles.
I'm really sorry, but you're not. You keep moving away from me. There. Toes curled. All right. So we'll just put your socks aside. And one quick last thing. I'm just gonna borrow your wrists, and I'm gonna check for clonus. Okay. So it's gonna be a quick movement. No need to worry. All right. Good. Good. No beats. All right. Next.
Okay. So now we're just gonna do a little palpations on your back. Okay. So if you can come and lie, is the bed okay like this? Or do we use the bed?
Yeah, no, it's good.
Yeah. If you want to come, we're gonna put your head in here.
Down.
Yeah. Down. So on your stomach. You want to take your glasses.
Oh, I want to put it.
Perfect. Just gonna bring that slightly higher. Are you comfortable? Yeah. Got that head a little lower. You okay?
Maybe just a little bit.
Good. So, palpation, a little tonic here on the left side. I mean, really on both sides, but the left side feels a little tighter. And then like mid-thoracic spot. Is this around where your pain is?
Yeah, I think a little higher.
So we're just gonna start with some PAs here. So we're at T1. Do you have a point for next?
No.
I have a pen, I have a pen.
Oh, okay. And then, oh yeah, whatever.
So right now I'm just on the Z joints. I'm looking for a decreased neutral zone, part 1.
Where your finger is right now is where
She was like getting off her pen.
Because I feel like where it all started 2 years ago was around that area.
I'm sorry, I just wrote on you, is that okay?
Yeah.
Do you have pain there now?
No.
I will count the level afterwards. I feel like okay. So based on our range of motion, it's same side rotation and same side flexion. So I wouldn't need to do the CT joint, right? Okay. And then if I just count this down, give me a second. I have something in my head. If someone wants to come confirm.
I will come confirm. Just want to make sure my third is correct. So same thing, looking for neutral zone R1, R2, and NPL, and pain. So just let me know if you have any pain throughout.
I know, this is gonna make my left hurt too.
It's like a little sensitive there.
A little sensitive.
It's a little sensitive too.
Mm-hmm. Got a little knot there.
I'm gonna say that's gonna hurt.
So to confirm, I actually also had, let me just confirm the level. It's fine, I kept it in my head. So I had early neutral zone, R1, R2, and early capside field, but for both T3 and T4.
I had 267. Are my daughters?
No, I don't think so
Did I
either.
miscount?
Does someone else want to go now?
Yeah.
Go for it then.
That's what we're
Yeah, that's
confirming.
So this is,
I had like the 2 levels, so like.
should I just redo them all or should I just go to that level that you're at?
You can do like
Maybe-
above and below.
It was both at same level though, right?
On the left
I
side.
had 2 levels though,
Right, but her pain, like we'll focus on the one where her pain was at.
but she had pain on both.
But like her main, like P1.
But that's
Well,
It was
ask her.
yeah.
she was sensitive at both parts.
And I'm at T5, T6, anything here? Here.
Yeah, right there.
T6, T7. What did you have? T6, T7.
It's also possible that there were
Maybe there was another one. So let's put T3, T4, and then T6, T7. Yeah. Okay, so do you want to maybe just discuss a little bit our finding, then we'll go to biomechanical?
Yeah.
That good?
So Tiff, you can take a seat.
Yeah, should we discuss it around
breather?
Yes.
Don't worry,
Relax,
you're
you
just
stay there.
beautiful.
Your glasses or
Yeah, I'm really glad.
You can sit up, because that's not good for your back.
Okay, she's like to go to the front of it.
yeah.
Okay, so should we take these things out? Show the difference or?
We can do a little spin around the camera if we want.
So, given what we found just now, there's hypomobility at T3-4 and T6-7.
Are we discussing with her or not?
Are you discussing with me?
No, I don't
No.
know.
No.
We're powwowing.
Okay,
Yeah.
now
This is like internal head dialogue.
Okay,
This is like if we weren't.
okay, so.
And then given her range of motion combo with decreased extension, left rotation, left side flexion, it's a decrease in hypermobility and extension.
On the left side.
On the left side,
Yeah.
those levels.
Of the Z joint.
Of the Z
joint. Yeah. So now we're gonna do the biomechanical assessment just to really confirm our findings to make sure it's in those directions.
Yep,
And
and
if
then
it's her pain, it works with her pain.
And then in the palpation, how much muscle tone would you be able to quantify it like?
I mean, hyper. No, I don't know.
Yeah, it was
It was
hypertonic.
Yeah, I think
Like
so.
both sides were
Increase.
hypertonic, but the left side was a lot more.
Okay.
And especially in when I made her do the rotation, the left side rotation was a lot more elasticy.
Okay.
So I think there might also be like a bit of a myofascial pain.
Yeah,
component
for
to
sure.
it. Yeah, so that would be something you'd have to work out first.
Yeah, and could also be why she kind of feels some stuck with the cervical flexion, just because it might be it's more releasing her muscles. And even like rounding back, it kind of stretches her back muscles.
Alright, cool. Good talk. Let's go.
Alright. Okay, so I'll do so I'll do the functional movement kinetic test for the Z joint. So how should we have?
She should be facing the other way.
Yeah. So I'll
Okay.
have you I'll have you facing this way. Okay, that's okay.
Yep.
Okay, so basically I'll be going
Yeah.
for the Z joint, I'll be going at the level above and below. So let's say I'm here. T4, T5. So I'll be at T5, T6. Okay, so I'm on both set joints. And now, Tiffany, I'll ask you to lift your right arm up towards the ceiling. Okay, and we kind of see that going inferiorly. Okay, you can go back down. And then you can do the same thing. So we do see that it moves inferiorly as well. Okay, and then I'll go to the next level. So again, with your right arm. Okay, and now come back down. And this one. Okay, so we can see, but not so much movement inferiorly on this one. And then we'll go one level below. Okay, not much movement on that one either. And here again, it moves more inferiorly. Okay. Great.
Alright. Now we'll have you sit at the edge of the bed with your legs coming up this way, and you're gonna go for a ride.
Go. You go.
No.
Well, we can move the table first and then. Sorry. There we go. Tell me when.
Keep rotating. And you get there.
Ready? 1, 2, 3.
So you're right.
Wow.
You're welcome.
Alright, so I'm gonna get to sit on the edge of the bed. Comfortable there? Yep. Alright, so I'm gonna get you to cross your arms over your chest, and then we're just gonna take a look at how things are moving. So we're gonna start off sides of right side to start, and we're gonna go into extension for start. And we'll be going up and over. And then I'm just gonna get you to slightly lean forward for me. Perfect. Oh, actually, go up there. Anything?
Do you want me to like help you or just relax?
No, just relax. So we'll decrease the T3, 4, and then T6, 7 again. And now we're gonna go into rotation. So, right compared to last side, there is a decreased neutral zone around 2 for T3, 4, and T6, 7
In rotation.
in rotation on the left side, so rotation to the left. And side flexion.
Coffee cup?
Yes, please, thank you. So decreased neutral zone here. Anything with these? No. So I'd say T3, 4, T6, 7 again, going to left side flexion.
Alright, I'm just going to confirm again, and bring this up a bit. You feeling okay still? Yep. Alright. So again, I'll have you cross your arms. Alright. And back down. Oh, sorry. Okay, T1. So, I'm gonna sneak over here. Can you come forward? There you go. And two, three. Okay, I also found the same thing as Antoinette for extension.
Extension?
Yep, and then we're gonna do rotation. So let's first do rotation to the right, which is this way. Can you cross your arm again? Just so that we can do the unaffected side first. Okay. I'm actually gonna put you up the hair. Okay. Yeah, that one's. Okay.
When doing all these movements, it's like irritating. Like I kind of said it before, but like
Irritating your
upper,
jaw.
like thoracic neck-ish area.
Okay, good to know.
Is it when you're doing the movements or is it the pressure on your shoulder?
No, it's not pressure. It's just like feels irritated.
Confirming the rotations that Antoinette found, I found the same thing. And then side flexion, we'll do to the right first. Oh, sorry. Okay. I'm just gonna move
And
it
that
like
all the way over. Greatest spot for you guys.
It's okay. It's a very nice bra. This is your left side, correct? Just checking. Right, so nice and front. You doing okay still? Yep. Okay, yeah, so down there. Okay, I confirm what Antoinette found again in the side flexion.
Perfect.
Okay.
Do you just want to do unilateral then?
Okay, so basically what I'll be doing is, this is the flexion elbow. Okay, so I'll have you scooch a little closer to me. So basically what I'm going to do is I'm going to do unilateral extension. Okay, so you can cross your hands like you had from before. Okay. Okay. And it's going to be here. And so just shift a little, okay? And so I'm going to extension, side flexion, and rotation. Okay, extension, side flexion, rotation. Extension. Little stiff.
How's that feel, Tiff?
How was that C3, C4? Is it uncomfortable?
No, it's okay.
sorry. Bring her back to the starting position. Extension, side flexion, rotation. Okay. So this is stiff again, so I'm at that yeah, you feel it? Okay, before I even go into side flexion, and then minimal movement there.
So same level?
Tip.
Sweating a little.
Which one bothers you more, the spot on top or the spot that we've been talking about lower
No,
down?
so I didn't feel it. I didn't really feel
So
stiffness.
yeah, 'cause that's the right side, right?
Yeah, she
More than
felt a
6,
little
7.
stiffness, but it wasn't at a level that we had assessed.
Okay.
Yeah.
Yeah, so right side's good.
Yeah.
Stiff everywhere.
Yeah, she was just like a bit stiff, and she felt pain more onto one side. But okay, so we'll do it again. So cross. Okay, so just shear a little here. Okay. So she'll just grab it and
She's a little shifted.
Is it shifted?
Yeah.
Okay. So extension, side flexion, rotation. Extension, side flexion, rotation, sounds good. So extension, side flexion, rotation. Does that feel okay or a little stiff?
Well, that one doesn't feel that great.
Yeah,
It doesn't hurt, but
And
it's
so
just...
that was T67, but to be honest, I didn't feel any difference in T3, T4.
Okay.
But maybe it's not a unilateral extension, I don't know. But T67 was limited and painful for her.
Okay.
Now what?
Pain, just pain. Alright, so now we're going to do a technique called a pavlov. I'll have you, first let's move the bed and then we'll lie down on your tummy. So heads up. Let me know.
Can you slide the bed a little bit that way? Good.
Ready? 3, 2, 1. Always
I think
thinking.
you get used to it. I'm laying down, right?
Yeah, just let me fix the towel for you first.
I guess not.
Those here. Alright, is that comfortable for you? So, what we're going to do is we're going to do what's called a pavlov, just looking at the passive and accessory movements between the vertebra. And we're going to be looking at T3, T4, T5, T67. In extension. Yeah. So, this bed is too low for me. There we go. There's T1, T2, 3. I'm gonna stabilize T2, 3. This is your left side, correct? Alright. So, T1, 2, just gonna check. Okay. So. Does that bother you at all?
I was gonna say the first one you did before that was uncomfortable.
Okay. Was that because of my handling or because it is your
Just
pain?
the move, yeah.
Okay. Is your bra comfortable for you like that?
Yep.
Okay. 1, 2, 3. This one?
That one's okay.
It was this one up here?
Yeah.
Okay. So that was a little stiff. How's that?
Okay.
So I'm just gonna do that one more time so I can count. Because I forgot to count. So, 1. This one was the one that was bothering you?
That one bothers me.
Okay. So that's actually T1, 2.
An extension?
Yeah.
On the
Left side. But yeah, T3, 4 is stiff. 5, 6. How's this?
That one's okay.
Okay. But it feels quite stiff. I would say it's about half range.
Like in doing those, like
It aggravates here.
It's aggravating my upper
Trap.
like neck.
Okay. You relax back down. Yeah. There's a good bit of tone here. Yeah. So let's look at your ribs. Real quick. No, we don't need to look at the ribs. Kidding.
Did you
So-
do T6?
Yeah, it was half range, really counts. Someone needs to confirm my balance.
Hello.
And then you said here, cross
Yeah.
the side. Oh, did I go on the other side, right? Okay. Does it do it on both sides?
No, like the left side more.
More?
Like,
irritated?
Yeah.
And is it like a radiating pain that happens when it, or is it
Like a little bit, because even as you move down and push down, it's more like up here.
up into the neck?
Yeah.
So I'd say still at like T6, there's still half range, but I'd say like T2 and then T3 is also half range. Like, or I guess early caps compared to the right side. So
T1,
left side.
T2, or T2, T3?
T2, T3.
And this one higher up hurts more than the other one.
Then the one that
T1.
T2, T3 comes with pain?
and sorry, T1, T2, T3 are half, but T1 is more significant with the pain. Like it's causing the radiating pain. So shall we all gather together to discuss?
Explain.
Well,
Discuss and then.
discuss and then we'll talk
So
about it.
you can come on up and then we're gonna talk to the camera and then we'll talk to you.
I'm really blind.
Yeah.
Yeah, I can tell you're like,
Okay.
Well, let's just see. Sorry, everybody gather in and I'll tell you.
done like palpating.
Yeah, you can put your shirt back on.
But I think you need to be here for this conversation.
Oh, well, we can talk first
Oh,
and then,
yes,
yeah.
okay.
So gather in. Gather in.
Because-
Squish in, squish in. Okay, I'll go on that side.
You got it?
Yeah, we both. So I'm thinking there's a hypomobility and extension on the left side. At which levels do we have again? So we have T3, T4, T67,
Yeah.
but I think there might be a big myofascial component to it just because of like the radiating pain just from applying like pressure down. And even through palpation, you can tell that it's like way stiffer on the left side on the right.
And also in the neuro exam, we provoke kind of that radiating pain by activating those muscles. So keep that in mind.
And then in terms of the one that caused the most pain, Tiff was saying T6, T7, correct?
Yeah, because when I was doing the PA on that one, she said that was like the originating point of the pain.
Yeah, like originally it was the straight PAs was T67, but then what you were just doing was more like the higher up one.
Okay.
So we found things along the way. So I guess like really our big impression after doing all those things is that she's hypo on her left side at a Z joint. So it's T3, T4, and T6, T7 are what we found originally, and then a little higher up at T1, T2, and T3, T4. T2, T3, sorry.
With a myofascial component causing some radiating pain, and that's to her neck, and that's limiting her participation in her exercise activities and
Overhead.
Yeah, her overhead movements such as CrossFit.
So it all fits with the subjective that she was talking
I
about.
think myofascial release prior to doing some of this might give us a little bit of a clearer picture.
Yeah, and it'll help us get a bit more range in terms of the joint mobility.
For sure. So in terms of our treatment plan, so we'll tell you a little bit about our treatment plan.
Is she supposed to know what she has? Like, I feel like.
Yep.
Yeah. Okay, so after doing our whole assessment, we found that you're limited on your left side, one of the Z joints, so one of the joints in your spine. It's having trouble going into extension, okay? Which works with what you were saying, bringing your arms above your head, that makes your spine go into extension, so that's why it's causing you a little bit of pain. Oh yeah, here we go, that's good. Okay, so if we count down, anyways, so the joints here are what we find that are a little limiting. Okay, so when you go into extension, right, they're not moving in that right direction, so that's what's causing you pain. So that's why when you go into flexion, you feel much better because now you're not going into that back motion, right? So yeah, and the same thing when you lift your arms up. When you're lifting your arms up, pretend you are here, it makes the spine go into extension, which is why it's uncomfortable for you to do those overhead movements. Okay.
What should I do? Okay, so first of all, just in general in our treatment plan, there definitely would be a myofascial component, so releasing the upper traps and then like the scapular stabilizer muscles for sure. And then we would do like some manual techniques, so some pivots, some pavins, going into extension with some rotations. And then you would have an exercise program, again, mostly in the limited motions, so we would target exercises in thoracic extension as well as rotation.
Yeah, so really the goal is working in that limited movement pattern that you have. So really kind of stretching it out in that direction so that we're getting you comfortable with going back there and improving the range. So everything that Leandra said is going to help you get there.
Thanks.
Great. Oh yeah. And we've assessed you right for quite a while today, so you might be in a little bit of pain for the next couple of days. So when we were asking you, what makes you feel better, so you said heat might help, so we can do that and give you some stretching to do. It might help you kind of release that pain for the next couple
But
of
if
days.
ever the pain is too excessive, feel free to give us a call because that shouldn't be normal.
And yeah, so we're gonna 2 or 3 times a week? You want once a week? Twice a week? Twice a week? Okay. So the goal would be to have you come back twice a week, okay, to come see us to have some of the techniques she was doing that you can't really do on your own. And then we're going to give you a home exercise program for you to maintain that as you go. And then we'll reassess along the way to see if we need to change anything. Do you have any questions, any concerns?
Are you going to show me what I should do at home?
Yes. Well, we're a little bit on time constraints.
Okay.
Are we?
We have 10 minutes.
Do you have an exercise?
You do the assessment? Okay, go for it. Okay. Well, if anything, we could just include this part. Okay, so we'll work on the extension part, so you can lay on your back.
Ideally, you wouldn't be doing this on a bed.
mean at home. Make sure.
Well, yeah, that's right. So should we do it on the floor? Or we're
Yeah.
on the floor.
We're gonna do it on the
Okay.
floor so that the
So-
camera can see.
yeah.
I mean, on the table so the
So-
camera can see.
Like this.
After
Okay,
that,
put your
on the
hands
floor.
like this. Okay, so a little bit. We're gonna roll it up a little underneath. It's a little lower, and now you're just gonna bring yourself back. Okay, so hands like that, and bring yourself back. Can you see?
Yeah, there we go.
Okay, keep going. So again, your hand stabilizing your neck, and keep going. Okay, any kind of pain with that?
No. I do this all the time.
Good.
This is my
There you go.
go-to.
You know. Okay. Perfect. Exactly. So you can kind of roll this to go up a little on the higher parts, and then since we found one at T67, then you can do that.
And you can also, like, to begin with, that won't be as irritating, but as you feel like you're getting a bit better at it, you can actually bring those further apart to get a better extension.
better.
So whatever feels better, if you find those feel better, then you can do those more.
And as those get easier and easier, we can give you modifications.
Yeah,
to
Yes,
for sure.
keep
We'll start
improving.
with that, and then we do one more patient.
Yeah,
so
holding it
farmers.
at the end of range. So you're gonna do that. Hold it at the end of range for what, 2 seconds? Or we hold 5
Yeah.
seconds? Holding it at the end of range for 5 seconds and coming back up. And doing that
Proper breathing.
10 times.
10 times.
10 times, and then 3 sets of that.
One spinning.
I would do
3
one
times
3
a day?
times a
3
day.
times a day, yeah.
Just
honestly,
because you're very
yeah.
stiff, so we're gonna try to get a bit of movement and then
we don't want to irritate you, right?
You said hold for 5 or for 2 seconds?
5.
Okay.
Hold for 5.
Again, but if you feel any pain, like a loss of discomfort, then you come out of it, and you can also do it as much.
Exactly. And if you feel like 3 times a day is irritating you, then you can do it once in the morning when you wake up and then once at night before going to bed.
Any questions?
So before you were asking if I took any anti-inflammatories, was that something you would recommend I should be doing at this point?
If you feel like you really need an, oh geez, I'm so irritated today, it's like really bothersome, go ahead and do whatever you need to do to help decrease that pain. Again, we're not doctors, we're not pharmacists.
So you
That's
can
not
always
our scope, but
Go to your
so you can always talk to your pharmacist about it.
great.
You
But if
also
you need
have and you also have topical creams that you could use too, so it doesn't necessarily have to be like a pill form. Yeah, exactly. And now those you can talk to your pharmacist about it too.
Any questions?
Warm baths and
I love warm baths.
and
Bath
bath salts help too. So
Thank you for your time, Tiff.
yeah,
Thank
And,
you.
very soon.
we'll see you in a few days.
Wonderful. Thank you.